All right, let's talk about methotrexate. Now, this is one of the most important drugs out there. It's a total workhorse, super low cost, but it has this really complex kind of dual identity. It can be a little confusing, so we're going to unpack it together.
So here's the big question, right? This is the paradox we're really going to dig into. How can the exact same drug be used to fight something as serious as cancer and also treat something like arthritis? I mean, think about it. In one corner, you've got this powerful chemo agent designed to just destroy cancer cells. But in the other corner, it's a go-to treatment for calming down the inflammation in diseases like rheumatoid arthritis. So what gives? How can one little molecule do two jobs that seem totally opposite?
Well, the answer, the secret to its two faces, it all comes down to one single crucial factor. The dose. Yeah, that's it. The amount of methotrexate you take completely changes what it's supposed to do inside your body.
Okay, so let's think of it this way. At a high dose, methotrexate is what we'll call the warrior. Its job is simple. Go in and kill those rapidly dividing cancer cells. But when you bring the dose way down, it becomes the diplomat. Its mission is totally different. It's not there to kill anymore, it's there to gently calm things down, to modulate an immune system that's gone a little haywire. It's the same drug, but with two completely different battle plans.
So, how does it actually pull this off? Well, to get to the heart of methotrexate's power, we have to talk about something your cells absolutely need to survive and multiply. And that something is a B vitamin called folate.
You know, the way it works is actually pretty clever and surprisingly simple when you break it down. So, your cells need folate to build new DNA, right? But they can't just use it raw. It needs to be activated first. And the key to that activation is an enzyme called DHFR. Now, here's where methotrexate comes in. It's basically a master of disguise. It looks so much like folate that it completely fools that DHFR enzyme. It gets in there, binds to it, and just blocks it up. This causes a total supply crisis of activated folate, and without that crucial ingredient, cells just can't build the DNA they need to replicate. Their whole assembly line just stops.
Okay, so let's see how this all plays out with its first identity, the warrior. When we're talking about chemotherapy, the entire goal is to use that folate supply crisis to our advantage and push it to the absolute max.
I mean, what do cancer cells do? They divide like crazy, right? Uncontrollably, super fast. And because of that, they are incredibly thirsty for folate to build all that new DNA. So by cutting off their supply, high-dose methotrexate basically starves them out. It's a real game changer for these really fast-growing cancers you see here, things like leukemias and lymphomas.
But, there's a problem. These high doses can also hit our own healthy cells that divide fast, like the ones in our bone marrow or our gut. So doctors came up with this brilliant move called a leucovorin rescue. Basically, after the methotrexate has had enough time to do its job on the cancer cells, they give the patient leucovorin. It's a special form of folate that can sneak past the methotrexate block. It's an amazing strategy, right? You target the bad guys and then swoop in to save the good guys.
Okay, now let's flip the script and look at its other identity, which is actually way more common, the diplomat. This is the version of methotrexate that millions and millions of people use for autoimmune conditions. With this version, the dose is way lower. We're not trying to kill cells here, not at all. Instead, the whole mechanism is much more subtle. The low dose just gently nudges those overactive immune cells, kind of encouraging them to release the body's own natural anti-inflammatory stuff. So yeah, it's way less like a bomb and a whole lot more like negotiating a peace treaty. And that diplomatic approach is exactly why it's become a cornerstone treatment for so many conditions where the immune system is basically attacking the body by mistake. For rheumatoid arthritis especially, it's often the very first drug doctors reach for. Why? Because it's just so good at tamping down the pain, the swelling, and preventing that long-term joint damage.
Look, because this drug is so powerful, it doesn't matter if it's in warrior mode or diplomat mode, using it safely is everything. It's absolutely paramount. So we need to talk about the user's manual.
Seriously, if you remember just one thing from this whole discussion, I want it to be this. For anyone taking methotrexate for an autoimmune condition, there is one rule that is absolutely 100% non-negotiable.
That's it. Once a week. Taking low-dose methotrexate every day by mistake can be fatal. I'm not exaggerating. It allows the drug to build up in your system, and then it starts acting like a warrior, killing off healthy bone marrow cells. It has to be taken on the same day, once every single week, no exceptions. This is the biggest danger with this medicine, and the good news is it's completely preventable.
Now, of course, there are other potential side effects, but the important thing is that they are really well understood and they're manageable. The really serious stuff, like the risks to your bone marrow or your liver, those are watched carefully with simple, regular blood tests. And the more common things, like nausea or maybe some mouth sores, well, those are often handled by taking a folic acid supplement. Just make sure you take it on the days you're not taking the methotrexate.
So, besides that critical once-a-week rule, here are the other big ones you have to know. First, those regular blood tests, they're mandatory. No skipping them. They're essential for watching your blood cells and your liver. Second, and this is huge, this drug can cause severe birth defects, so it is an absolute no-go if you are pregnant, planning to be, or breastfeeding. Third, you really need to limit or just avoid alcohol to protect your liver. And finally, you have to tell your doctor about every single thing you're taking, because even common stuff like ibuprofen or certain antibiotics can have dangerous interactions.
So we've seen its two faces. We've gone through the user manual. What's the big picture? What should we really take away from all this?
When you boil it all down, Methotrexate is an incredible tool. It's powerful, it works, and it's low cost. It has literally changed the lives of millions of people. But its power demands respect. It really requires a partnership between you, the well-informed patient, and a careful, vigilant doctor. And when that partnership is strong, it's honestly one of the most successful medicines we've ever had.
And that kind of leaves us with a really fascinating thought, doesn't it? I mean, methotrexate is an old drug, but it's such a perfect example of this very modern idea that you can take a single tool, a single molecule, and just by tweaking the dose and the context, you can use it to solve completely different problems. It makes you wonder, what other two-faced drugs are just sitting out there waiting for us to discover their other side?